Hello and welcome to Thrive eLearning. We're thrilled that you've decided to join us for the Thrive ePulmonary program. The ePulmonary program is an all-encompassing masterclass that will empower you with all the skills that you need to take control of your respiratory disease.
If you've been diagnosed with COPD, you've probably learned that breathing exercises are essential for symptom management as well as for slowing disease progression. Maintaining lung elasticity helps prevent breathlessness and damage to other organs caused by oxygen deprivation. First, let's take a moment to review how the body gets oxygen. We all know that your lungs are your main respiratory organ, but your nose, mouth, trachea, and larynx all participate in the breathing process, with most of the work being done by the diaphragm. You've likely heard a lot about respiratory muscles, but you may not know that lungs themselves don't have any muscle mass of their own. They actually act as a bellows of sorts that are pumped using the diaphragm. As the diaphragm contracts or moves downward, it causes the lungs to expand, drawing in air or inhaling. As the diaphragm expands, it pushes up against the lungs, forcing air out or exhaling. The trachea leads to smaller tubes known as the alveoli, which are small sacs that are surrounded by capillaries. These capillaries take oxygen via arteries into the heart, which pumps the oxygen-rich blood throughout every cell in the body. As your body is using oxygen for various functions, a waste gas known as carbon dioxide is produced, commonly known as CO2. It is then transported back into the lungs to be forced out of the body or exhaled. When you are feeling short of breath or fatigued, it's usually not because you are not able to take in or enough air in. It's because your body is not fully exhaling, leaving your lungs full of carbon dioxide. As far as gases in the air go, the body is only able to use oxygen, but the air we breathe is only 21% oxygen. It is 78% nitrogen and 1% various other gases, which must be exhaled along with CO2 in order to take in more oxygen. Often when patients begin experiencing shortness of breath, it makes them want to avoid activity. When you do less, your muscles weaken, you get more breathless, and the cycle repeats and deteriorates from there. Instead, if you feel breathless, the first thing you need to do is work to keep your anxiety in check. If you learn to do these breathing exercises effectively, knowing that they will soon alleviate your breathlessness, it will help with that. It's naturally panic-inducing to feel like you're not going to get or not getting enough air, but when you become nervous or scared, your breathing becomes more shallow and moves up into your chest, making it more difficult for your lungs to clear out that CO2. So, if you start to feel out of breath, sit down, close your eyes just for a moment. Try to sit up straight so your rib cage is nice and open, allowing your lungs some breathing room. Take some nice deep breaths, exhaling as fully as you can. As you already know, the O in COPD stands for obstructive, meaning that your airways become inflamed and congested, making it difficult to breathe. In this next segment, we're going to teach you 3 breathing techniques which can be used for relaxation or to help with breathlessness. Used on their own, they can be very effective, but when you learn to use them in a cycle, not only will they help with your endurance, they will help keep your airways nice and clear. This is known as the active cycle breathing technique. In this course, you will meet several experts that we have invited to share their knowledge with you. Michelle is a fitness trainer and a certified yoga instructor. Today, she will show you the proper way to do pursed lip breathing, diaphragmatic breathing, and huff breathing or huff coughing. Then I'll be back to explain how they all work together. And now, here's Michelle.
Hi, today we're going to work on active breathing technique. This technique is to reduce chest congestion and to keep our airways clear. We're going to work on 3 breathing exercises. The first one is going to be pursed lip breathing, the second diaphragmatic breathing, and the third one is huff breathing. Let's work on pursed lip breathing. As with all breathing exercises, it's recommended that both of our feet are on the ground, all 4 corners into the ground, shoulders relaxed. Take a deep breath in, deep exhale out. Okay, so for pursed lip breathing, we're going to take deep breath in, hold it for 3 counts, and as we exhale out, hold it for 6 counts. Imagine yourself taking a deep breath in as if you're smelling a rose, and deep exhale out as you're blowing out a candle. So let's get started. Deep exhale in. Deep exhale out. Let's do that again. Deep inhale in 3 counts. Exhale out 6 counts. Let's work on diaphragmatic breathing. Diaphragmatic breathing is breathing through your diaphragm, also known as your abdominal wall. I want you to place your hands onto your abdominals, tips of your middle finger to touch, and press into your abdominals. As you take a deep inhale in, I want you to hold it for 3 counts. And as you inhale in, you will notice your belly expands, and as you exhale, your belly will contract. Let's try this. Let's work on huff breathing, also known as huff coughing. When breathing in, breathe in through your diaphragm, and as you exhale out, forcefully breathe out, making a ha or a huff sound. Let's try this. You'll find yourself, when you're exhaling out making that ha or huff sound, you'll feel a little bit of constriction in the back of your throat. Let's try this one more time.
Now that you've learned these techniques, you can use them for relaxation and to help you catch your breath if you're experiencing shortness of breath. Used together, they will help clear your airways. The first phase, pursed lip breathing, helps to relax your airways and open them up as much as possible. The second phase, deep breathing or diaphragmatic breathing, which helps to fill your lungs with air, getting some wind behind any congestion that might be present. The third phase. The third phase is huff coughing or huff breathing, which uses that air to force out any congestion. Your doctor or respiratory therapist can give you directions specific to your ability levels on how many cycles to do. However, we put together a sheet that reminds you of the proper techniques as well as suggesting a routine to follow. So, do 20 to 30 seconds of pursed lip breathing. Breathe in through your nose for a count of 3 and out for a count of 6 through pursed lips. Don't force the air out too quickly. You can adjust this count to your ability level, but if you do the exercise regularly, you should be able to do more over time. Then take 3 or 4 deep breaths. Again, put your hand on your belly to make sure it is rising when you breathe in. Take a big deep breath, pause for a few seconds, and exhale, really trying to push out as much CO2 as you can. Now, 20 or 30 seconds more of pursed lip breathing, 3 or 4 more deep breaths, and about 20 to 30 seconds of pursed lip breathing. Now, take a nice deep breath and force it out as quickly as you can, trying to keep your mouth and throat open. You will make a ha or a huff sound as you do it. This should help bring up any congestion that is in your lungs. Repeat the cycle again as you are able, or if you still feel congestion in your chest. As you lay down to sleep at night, congestion may settle on your chest, so you may feel that the technique is especially beneficial in the morning, but it can be done anytime you want to clear your airways. Throughout the day, if you feel out of breath, pause and do some pursed lip breathing. If you become anxious, stop, sit down, relax your shoulders, sit up nice and straight, take some nice deep breaths. So far, you've learned how to monitor your symptoms and some breathing techniques to help slow your disease progression and help calm symptom flare-ups. The next disease management tool you'll learn is what exacerbation triggers are and how to avoid them. Please leave a comment below and let us know what you think of the tips that we just shared with you. We would love to hear what you have to say.
Be sure to download your active cycle breathing guide so that you can follow along as you become more proficient at this technique. This breathing cycle should be practiced regularly to keep your lungs clear and improve lung function in general. Follow the direction of your doctor or respiratory therapist, but generally, this exercise should be done at least twice a day. This technique can be particularly helpful to clear your lungs when you first wake up in the morning. You may also find it beneficial to do right before you eat to prevent breathlessness as your stomach gets full. If you take an inhaled medication, doing the cycle beforehand will open your airways more fully, ensuring that the medication can be inhaled deeper into your lungs. You've watched Michelle demonstrate each of the techniques for you. Go back and review if you need to. The Active Cycle Breathing Guide reviews the proper techniques for each exercise and gives you a sample cycle to try and discuss with your doctor.